Hey, everybody. Hello and welcome to another Vegan Primary Care live session. This is Dr. Scott Harrington coming to you live from my doctor's office at veganprimarycare.com, where you can see a vegan doctor as your primary care doctor from the comfort of your own home from most U.S. states. If you happen to live in Florida, then I can also be open for in-person visits on Fridays in Pinellas Park, Florida, just north of St. Petersburg. Come in and see me, not just as a one-time consultation, but as your primary care doctor, someone who gets to know you and someone who can be your health advocate. Because I'm licensed in most US states, even if you move, you don't have to change doctors. If you are vegan, then get a doctor who gets you. If you haven't adopted a plant-based diet yet, you are still welcome to be my patient. But beware, a healthy vegan diet, exercise, and lifestyle changes will always be my first recommendation. My goal is to help you take control of your health. And through the power of a healthy lifestyle, we will work to heal your chronic conditions with the ultimate goal of helping you come off your chronic medications if that's possible. For my patients who cut out animal products altogether, you will not only be helping yourself feel better, but you will also do your part to stop animal suffering and to decrease the impact on the environment. In other announcements, we'll be offering vegan primary care patients free weekly weight loss check-ins, a weight accountability visit, on a private group chat on Zoom Tuesday nights at 7 p.m. Eastern Standard Time, where we share our weight loss tips and tricks among the vegan primary care community. Remember that this content is for educational and entertainment purposes only. This video is not intended to take place of your own doctor's advice. Okay, we're streaming live on multiple platforms and ready to take your questions. Okay. All right. We've got Mayanne Harry Shabosky. Hello. Hi. Oh, man. All right. We've got Tamara Sergi is here. She says hi as well. Oh my gosh. It's good to see you online. Tamara, I'll talk to you more later about what you're putting in the chat box. I'll talk with you more. I'm so sorry to hear that. So if you are here with us today and you have a question about the whole food plant-based diet, put it in the chat box and I'll see if I'll come up with something good to answer your question. If it's something very, very specific about your health, maybe go into the DMs and send me messages there. But we are here on Facebook, we're on YouTube, we are on Twitch and Twitter. All right. We have Karen Hodgins says hi. Hi, Karen. Good to see you. Good news here for Dr. Scott Harrington. I was on Chef AJ recently, and it was really a good experience. We've had 5,500 views so far, and we've had several patients come in regarding related to the Chef AJ interview. So that's really good. And so, yes. What are your questions today? Go ahead and put some questions in the box so we can go over it. I can put in some information we can talk about in the meantime. All right. Okay, here we go. Here's a question from Purity and Plants. What do you think about companies that offer to test your gut microbiome to tell you what bacteria you have? Okay. Well, I like this question because the gut microbiome is becoming more and more popular. We're talking about it, and they're learning all these impressive improvements that you get as you start to shift your microbiome to various bacteria species. Basically, the ones that eat more plant fiber as their main source of energy start to provide these fatty acids, short chain fatty acids. Specifically, one of them is called butyrate, which has a protective effect on the lining of your gut and an anti-inflammatory effect in your body altogether. So what about companies that offer a test to tell you your variety of microbiome organisms? And here's where I feel a little bit of a naysayer on this. Microbiome, great. Fiber fueling your microbiome, great. But what happens if it's hard to interpret? What happens if they tell you, oh, you have a little bit too many of this species or a little too many of that species? The microbiome is an evolving thing. So it kind of depends on the fertilizer that you give it, So our goal should be to eat a variety of plant foods so that you have a diverse microbiome. You don't want it to be like a clear-cut scenario. You want it to be like a rainforest, a great biodiverse bounty of different microorganisms. So what would you do with the information once you get the test? And if there isn't very specific recommendations, if the recommendation is to eat a whole food plant-based diet without added salt, oil, or sugar, then just do that. Then just do that and avoid a very expensive test. So that's specifically for that. Now, there are certain tests. Sometimes you have to do stool testing for various things if you're having inflamed colon and variety of other things. But in this instance, so far, I find that the clinical significance of it is more of a for research purposes than a clinical outcome or treatment. So great question, Purity and Plaids. That's kind of my recommendation for that so far. Okay, Karen says, thanks for recommending vegan D3. Yeah, who knew that vitamin D came from sheep's wool grease? Oh man, that one was kind of a freaky one. They shear the wool, they boil it, the lanolin comes to the top, and they derive vitamin D from lanolin. So if you go and you buy a vegan vitamin D, you can get the lichen-based vitamin D. Unfortunately, a lot of the vegan vitamin D suppliers don't have appropriate third-party testing, which we look forward to that someday. Hopefully, we'll get better. Like the U.S. Pharmacopoeia is my favorite third-party tester, but right now, a lot of the vegan diet vitamin D brands don't have that. So I'm hoping to see that in the future. Okay, Tamara says, what's your opinion on an aspirin a day? Is there foods that can do the same? So aspirin a day depends on your risk for heart attack versus your an ischemic heart attack where you have a clot versus weighed against your risk for hemorrhagic stroke. And so this is based on the Framingham heart study. If you have a certain percentage higher up, and the recommendations for aspirins have changed. So talk to your doctor, and what I would have to do for each individual patient, determine if this based on your risk for a heart attack. Secondary heart attack, someone who's already had a heart attack already has a more benefit from aspirin than someone who's never had a heart attack before. You have to treat more people with aspirin in order to prevent one heart attack. So it's an individual. The answer is it's an individual thing based on your ischemic heart attack risk, Tamara. What's interesting is there used to be enteric-coated aspirin was the recommended thing because aspirin every day could irritate the stomach, but they've stopped doing that. And now they recommend regular old baby aspirin due to absorption and issues with the pills that are enteric-coated not being absorbed appropriately. Okay. So Sandra Madrigal says, is there any way to get full blood panel ordered by you and received by you through insurance? Absolutely. So what can I do? Can I really be your primary care doctor and reach through here and listen to your heart and do all these things just like at a regular doctor's office? Well, there are limitations, but definitely labs are not a limitation. I could do labs, referrals, imaging. For my patients, I create a portal for you. So all of your medical records are all stored and you have access to it. So my patients, I can order labs through Quest or LabCorp, and from wherever you're located, if I'm licensed in that state, and we can get it set up. Absolutely, Sandra. Okay, Purity Implant says, thanks for answering my question. What is the wait time on an appointment with you? Well, right now we're about a week out. Okay. Marianne Harry Shabosky says, can you recommend something that might help skin sagging since we don't get the collagen from animals? I'm 58, starting to see my neck and my lower face starting to sag a little. Okay. All right, Marianne. Skin sagging is, I wish I was, more of an expert on skin sagging and the cosmetic aspects of diet. And so I guess I'm going to kind of fall short on this answer. However, what I found is that like wrinkles and, basic skin health and stuff is worsened by things like smoking and bad health and bad blood flow. And it's improved by a diet that is, that improves your vascular health. Okay. So you don't have to really eat extra collagen. Collagen is made by your own body. It's not like an essential fatty acid or something like that. So that is something I can tell you. You don't need to have extra collagen or buy this as a supplement or do anything like that, because your body makes all that stuff all by itself. So, that's the good news. That's the good news. All right. All right, Marianne. Yeah, I hope that answers. There are cosmetic procedures and stuff that people do, but part of the cosmetic outcome and concerns is that you worry that there's sometimes you can do too much, and then you can have sort of the appearance can be off-putting. So I tend to recommend minimal approach in terms of cosmetic type procedures and that kind of thing. All right. Madison Coleman says, is iron a concern for vegans? How can I make sure I'm getting enough iron? Okay, great question, Madison. Iron is one of the sort of elements of concern, nutrients of concern, especially for females, because with menstrual blood loss, you lose iron. However, a lot of people are always interested in getting their iron tested, and I can test iron. But the way I do it is I just test your very basic blood work called the complete blood count. Complete blood count will tell you whether you're anemic, and this is through the hemoglobin and hematocrit levels. So if you're getting enough iron, you will not be anemic. If you're not getting enough iron or you're losing too much iron through menstrual loss, you could be anemic. So sometimes we'll find if we do a CBC and an iron test at the same time, we'll find, okay, you're not anemic, but your iron levels are mildly low. And in this case, I don't freak out. I don't worry about it, because as long as you're not anemic, the body feels like you're getting plenty of iron. Sometimes there are iron storage diseases and things like that. And these types of people who have too much iron stores actually have problems like with liver problems and other health issues. It's potentially inflammatory. And so one of the things we can do is we could just do some simple blood work. One of my favorite things to tell people if they're having a concern about a specific nutrient is to use that free app called Chronometer. Chronometer is a free food logging app. Don't spend any money on extra pro, whatever. Just get the free app. Do the logging for 1 or 2 days of kind of an average food intake for you. Log it in, and it'll tell you you've had this many milligrams of elemental iron or selenium or zinc or whatever. And so this can tell you whether you're getting enough. And then a simple blood test can tell you if you've lost too much because of menstrual loss and stuff like this. What I would tell people is to make sure you're eating greens, beans, and grains, and nuts and seeds, because these have the highest iron. Pumpkin seeds comes to mind as one that has really high iron. make sure and eat it with something that has high amount of vitamin C. So if you eat things like broccoli and stuff like that, they're both packaged together. All right. Okay. Let's see. Oh, this is a good long question. Vita Liberata says, I'm recently started taking turmeric from inflammation, but not sure if I should take it once a day, which is what the brand I purchased recommends, or if I should spread it out either twice or 3 times a day, per options I found when researching it online. There are also varying expectations of how long it takes to really show results, 2 to 4 weeks, 4 to 8 weeks, 8 to 12 weeks. What do you recommend to your patients? Okay, turmeric is an anti-inflammatory product, and things like garlic and ginger and turmeric and these things, we're finding every time you look at it and you study it, we find some new amazing property from these foods. And so when you're dealing with an inflammatory process, I'll usually tell people 6 weeks. If you haven't found you don't feel a benefit within 6 weeks, to stop something. For inflammation, it takes a bone 6 weeks to heal. Acne changes and inflammatory markers and things like that can take up to about 6 weeks. Skin changes, acne changes, 6 weeks. 6 weeks is the magic number. 6 weeks is the body kind of throws up its arms and says, I'm done healing. I've done everything I can in the 6 weeks. It just seems to be a number that keeps coming up. So I find that if you're spending a lot of money on a supplement and you're looking for it to do a certain thing, if it hasn't done that in about 6 weeks, I would stop it. If you stop it and then all of a sudden you realize, oh my gosh, my joints are, your joints start to feel inflamed, or that kind of thing, then maybe it was doing something and it was sort of low lying. You didn't realize it until you stopped. So 6 weeks. How many times a day should you take it? The studies are all over the place, 500 to 2,000 milligrams, I believe, per day. So I believe that might be 1 to 4 capsules of the product. But it could be turmeric, which is less concentrated than curcumin, which is the concentrated. And so I'd have to check the dose, but I would take it. I would probably take it at least once a day if you're trying to get an effect, but you're going to want to make sure and take it with food, with something with fat in it, and you'll get the best absorption out of the turmeric component. You want to include pepper in the pepperine in the turmeric preparation, so that it will amplify and activate the curcumin aspect, the beneficial anti-inflammatory aspect of the turmeric. All right. Let's go with Joe Gerard. Thoughts on supplements to address long COVID, particularly shortness of breath, tachycardia, and fatigue. I've been vegan for a decade, but have had severe COVID early in the year, hospitalized for 3 weeks and on oxygen for months. Wow, man, Joe, thank goodness that you made it through. And I'm so glad to see you here and you're on the other side. This is awesome. Long COVID, long hauler syndrome. People have described severe symptoms, headaches, fatigue, shortness of breath, changes in their lungs, depressive symptoms. And so the body has the power to heal itself. The body has the power to heal itself. And it may kind of be your new normal in a way. When you come upon these disabilities and changes in your life, you have to sort of accept a certain level of where you're at, because you can't change the past. So, but you're always looking to get better and move forward. You're always tweaking your diet for better. We're not getting younger and less and more laissez-faire, less caring about our health. We're getting older, wiser, more in control, less alcohol, more exercise, more sleep, more self-care, self-awareness. And so that's I don't have specific recommendations, Joe, for you other than you are where you are, and to take each step each day one day at a time, and to continue to improve your health. That's what you have control over, and what you can manage is your lifestyle. You know, you can get good sleep. You can avoid watching your phone all night and worrying. You could do, making sure to avoid alcohol and other toxic, cigarettes and things. So maximizing your lifestyle, decreasing your stress. These are the things. I don't really have a secret in a bottle or in a pill. And so those are the generalized recommendations. I hope that helps, Joe. I know other people are doing green smoothies. Other people are doing omega-3s, upping their omega-3s, making sure they're getting ground flax, things like this. These are some of the things that I've heard, but I don't have the evidence on those. But certainly, I think they could not hurt. Okay. Thank you. Mayanne says, thank you very much. I absolutely glad to help. Glad you're here. Super helpful, says Madison. All right. Okay. Teresa Gleason says, a loved one of mine has been diagnosed with encephalitis. Is there any evidence based on dietary guidelines that can help recovery? Well, Teresa, I can't say that a plant-based diet is going to cure encephalitis. I don't have a research study that has put people with encephalitis on a plant-based diet and shown, against placebo or something, or, so I don't have that. But I hope that that your loved one is not in the hospital and is back from the hospital, and our thoughts are with you if that's the case. I'm so sorry. That sounds horribly severe. But sometimes, I guess you could say that sometimes these events, these major life events, can kind of kickstart your thoughts about health, and how health is, if you don't have your health, you don't have anything. So making the body the temple, and avoiding further kind of harming yourself. The body's amazing healing properties. And as long as you kind of stand out of the way and you don't put a bunch of toxins in your body, the body's natural sort of trajectory is to optimum health. And so if this loved one is in recovery and starting to see that, you can use it as a time to be like, let's be as healthy as we can so that you can get back on your feet again. No special tips for encephalitis, other than maybe trying to make sort of a bad situation a positive, trying to turn it around a little bit. Hope that helps. Okay. All right, Teresa, hope that helps. Okay, we've got Christy. Are there vegan foods that provide essential vitamin D? I don't like taking supplements. I agree. I don't like taking supplements either, Christy. So you can get vitamin D from the sun. Vitamin D is where it's from the sun. We don't spend a lot of time out in the sun, and sun can cause wrinkles and skin cancer and sun damage. And so it has to be weighed against that. If you live in a northern climate and you're getting very little sun, or the sun is not very powerful, you're probably going to need a supplement. You can get vitamin D through fortified foods and through some mushrooms and this and that, but the expectation is to be very low. So low in general across the population that they put it in milk, vitamin D milk. So things that are fortified with vitamin D are like milks and that sort of thing, milks and mushrooms. But there are not very many places where you get high vitamin D. I think that vitamin D also, you can get it from like mackerel or cold water fish or something like that. But of course, this is vegan primary care, so we're not doing that. So unfortunately, a supplement might be the most rational approach. I agree. I don't like taking supplements, but we're kind of stuck. If you're not wanting to do the sun, is with the vegan vitamin D supplements. Okay, we have got Roman. Is it realistic to normalize BP without drugs? I'm already vegan and have high BP. Okay. Roman, I'm glad you asked this because I talk a lot about disease reversal and treatment with the plant-based diet, but it doesn't always work. I wish it would, but I don't want to make promises and stuff like that it's going to work for everybody. It puts you in the best situation, but sometimes if people are eating really high salty foods and they're eating a high protein in their diet, we're going to get a great response when you shift to a plant-based diet. But if your diet was already pretty clean and pretty low in sodium and you're still dealing with the high blood pressure, then the expectation is that you're not going to get to a total reversal if you're still high and doing everything right. So I of course, in my heart, I would like to be able to believe that we'd have the ability to 100% all the time do this totally with diet. But I know rationally in my mind that we still have the tools. We still have blood pressure tools, blood pressure medications that we can rely on. And so people sometimes, rope me into the idea of an alternative provider, an alternative doctor. But really, I just feel like, I'm just following the evidence guidelines. We know that diet and lifestyle can affect blood pressure, and that should always be the first line treatment. If that doesn't work and you're there, the next step would be medications. And so if you find that despite eating right and despite being on multiple blood pressure medications, you may have a secondary cause of blood pressure. It might be your parathyroid hormone. It might be narrowed arteries that lead to the kidneys, renal artery stenosis. So there's tumors that secrete stimulating hormones, catecholamines. These things can raise your blood pressure. Another big problem for blood pressure is sleep apnea. If you're snoring at night and then basically you're stressed all night, and so it raises your blood pressure. So that's the thing. If people notice that you're snoring or you're gasping at night, you wake up with sweaty, with sore throat and a headache, get yourself checked for sleep apnea, which raises your blood pressure, stresses you out all night and doesn't let you get good sleep. And then, because that's a potentially reversible cause of high blood pressure. Hope that helps, Roman. All right. Okay. Purity in plants, flaxseed and chia seed make me vomit. How can I get omega-3s? Okay, well, there's walnuts and in the greens family, purslane is another one that is kind of high in omega-3s. There's omega-3 supplements, but various sort of native greens and things like I think even dandelion, stuff like that, is a little bit higher in omega-3s than the typical greens that we eat. But purslane is one that comes in high omega-3. Purslane is this, it's a weed and it's a green, but it has kind of a succulent type shape, and it's crisp when you bite into it, and it's actually pretty pleasant. It's something that you can throw it out in your yard and it'll grow like a weed, and you can just grab it up. It's amazing. Purslane. It's like I need to start making ads. I need to start making ads for these amazing cure foods, like free, amazing superfood. Okay. Roman says, yeah, I've been vegan for a long time, but have high blood pressure. Yeah. So watch out for your high protein intake. Sometimes even foods like, if you're really hitting the beans hard or hitting protein powders and stuff like hard, these kind of things, you got to, dial it back. You want to up your numbers on your greens, the high nitrate foods. These help dilate the arteries. This is good stuff. You want to do that. There's hibiscus tea. Hibiscus tea is a known blood pressure treatment. It's the red zinger or the passion, Tezo passion tea. You can use that almost as a treatment. 5 tea bags and 2 cups of water throughout the day as a treatment. But if you're vegan and you're not like a junk restaurant, vegan food, vegan, you're a whole food vegan, plant-based, no salt or sugar or oil added, and you've dialed it in A+ 5 stars, and your blood pressure is still high, you need to be looking for secondary causes, Roman, and talk to your doctor. Make an appointment with me. We'll work it out. That's what I recommend. Okay, Willie Epps. Willie Epps, I got to say hello to you, and you are great too, sir. I really appreciate it. Willie Epps is one of my esteemed colleagues from the Philadelphia College of Osteopathic Medicine way back in the day. Willie, I might start to cry that you're here because I'm so fired up. I appreciate it. Thanks for being here today, Willie, and I appreciate it. All right. Okay. Teresa says they are in recovery. Thank goodness. Thank goodness. I thank you for letting me know. All right. Roman says thank you. Okay. Fernanda Thompson says, can aortic valve sclerosis be reversed? Okay. I am going to put this out on a limb, Fernanda, and say that if you have bad aortic valve sclerosis, I have not heard cases of bad aortic valve sclerosis to be reversed. So you can make sure and decrease your afterload by making sure you decrease your blood pressure by being, so dealing with what you have and trying to maximize and minimize additional harm by eating the best diet you can. You're going to want to have a good cardiologist who monitors this periodically with an ultrasound of the heart called an echo to monitor the progression. And so I think the biggest hope would be to halt progression. So I wouldn't want to make any promises that could be reversed because I've never even seen a case study that suggests reversal there. So what you're aiming for there is afterload reduction, basically blood pressure reduction through eating the right diet, lowering your salt intake, and closely monitoring it so it doesn't cause other health problems. Sometimes people have to have surgical procedures or and if it gets really bad, valve replacement. All right. Cindy Rodriguez Romeo says, hi, good to see you. All right. Okay. Teresa says, how does a high protein diet lead to high blood pressure? How does this happen? I have the same question. But there's a couple of things. High protein causes hyperfiltration for the kidney. It causes the kidney to work harder. The kidney is the kidney is the chief monitor of our blood pressure. And so it can release fluid or retain fluid to make sure that the pressure is appropriate, the fluids and electrolytes are appropriate. So, but when you eat a high protein diet, it causes hyperfiltration. The body's having to work harder. So that's one aspect. There is other aspects called the PRAL score, potential renal acid load from the protein. And so animal proteins have higher potential renal acid load, PRAL score, and even beans have a little bit of acid load to the kidneys. Things like fruit and vegetables are alkaline producing, and so they're helpful in preventing an acid load or reversing acid load. So this is another reason why it causes elevated blood pressure. So, all right. All right, Roman says, you're very charismatic. Thank you. I'll take a pat on the back. All right. Okay. I'm going to leave the patient comments alone. And I am going to stop there. I really, really appreciate everyone's participation today. It's been an honor to be with you and to answer your questions. Stay vegan, go vegan. And if you have any questions specifically, send them to me and we'll go over them together. Okay. You guys take care. Thanks again for showing up, and see you next time.